Knock, knock. Good morning, Mrs. Smith. My name's Brandy. I'll be your nurse doing your head-to-toe assessment today. Give me 1 minute to wash my hands. All right, I'm going to pull the curtain. And can you tell me your name?
Sue Smith,
And your birthday?
7/3/56.
All righty. Well, again, I'm going to do a head-to-toe assessment on you. I read in your chart that you were having some pain. On a scale of 1 to 10, how bad is your pain?
About an
And where is it?
8. In my back.
Okay. I also read that you had a history of kidney stones, so we'll see if that's another kidney stone that might be passing. I noticed that your body isn't straight aligned and you're good, well-nourished and well-dressed with no other issues. I noticed also that the CNA had taken your vital signs prior to this. Your blood pressure in your right arm was 128/78 and in your left arm was 130/80. Those are within normal limits of each other, so no problems there. Your pulse is about 98, which is fine. It's a little elevated, but that's okay, considering you have pain. Respirations are 22, and your temperature was taken with an oral thermometer at 97.8. All right, I'm going to start by looking at you from head to toe. I notice that your hair is all there. You have no problems with hair, but you also have no hair anywhere else. No abnormal hair growth. Do you have an itchy scalp at all? All right. Next, I'm going to start by looking at your eyes. I see you wear glasses. Do you wear contacts at all?
No.
All right. Any abnormal eye movements or anything? All right. Are you colorblind?
No.
All right. Can you read the fine print on the newspaper here?
Yeah.
All right.
Repair or replacement is provided under this warranty. Exclusive remedy if you purchase it.
All right. Thank you, Ms. Smith. And you have no abnormal eye discharge, you use eye drops or anything? No? All right, very good. Next, I'm going to look at your ears. I notice that both sides are symmetrical. I don't notice any discharge or drainage coming out of them. Do you wear hearing aids? Any ringing of the ears? No? All righty. What I'm going to have you do is sit on the side of the bed. I'm going to do a whisper test where I'm going to whisper on both sides of your ears and have you repeat something. So if you can just sit on the side of the bed. Sit up. And face your back to me. Now if you'll place your right hand over your right ear, and I'm going to repeat something to you. Edison State College. Can you repeat that back to me?
Edison State College.
All right, and I'm going to have you do it with your left ear as well. Edison State College.
Edison State College.
All right, thank you. While you're in this position, I'm going to go ahead and listen to your lungs while you're sitting up. So if you can take a couple deep breaths for me. All right, if you want to go ahead and lay back down. I forgot to do one thing back to your eyes. If you could take your glasses off really quick. With a pen light, I would take the pen light and flash in your eyes and do it on both sides. And notice that your pupils were equal, reactive to light, round, and accommodating. You can put your glasses back on if you want to. Next, I'm going to look at your nose. Notice that both sides of your nose are symmetrical. You have no lesions, any blood bleeding, nosebleeds, or congestion or anything, any sinus pain. All right. Any difficulty breathing or anything? No discharge? All right, very good. Next, I'm going to look at your mouth. Can you stick your tongue straight out? All right, it goes straight down. It doesn't veer off to either direction. No mouth sores, no lesions. And do you have any bridges or dentures or anything? No? All right. Your teeth are in good condition. Your gums are in good condition. Nice and pink and moist. No coating of the tongue. Next, I'm going to look at your throat. I notice that both sides are symmetrical. Do you have any pain when I press here? All right. I don't feel any swelling. I'm going to listen for bruits while I'm looking at your neck. you sore at all in the neck? Any difficulty swallowing or anything? Nope. All right, I'm going to now take a general look over your skin. Do you have any sores, wounds, ulcers, rashes, any itching, flaking, redness, anything at all? No? All right. You don't have any swelling in your feet. Your skin's nice and warm and dry to the touch. Does it hurt at all when I palpate here? All right. And then next I'm going to look over your arms and your hands. Any problems with range of motion? Can you go like this? And can you do it with your ankles? Any pain or anything? And you can do it with your neck, look both sides, look around. All right. Next I'm going to press my hands on your shoulders and you're going to shrug them as I push down. Shrug your shoulders. Any pain with that? No? All right. It's equal on both sides. Next, I would have you do the Romberg test, which I'm not going to have you do, but I'm going to explain it. And that's where you would stand straight up. And what I would do as the provider or the nurse doing the test is stand behind you and kind of give you a little push to make sure that you can still hold your balance, even though you're being moved by an outside force. You can do that from all 4 different angles. Next, I'm going to listen to your lungs and your heart and your abdomen. I'm going to start by listening to your to your heart, excuse me. I'm going to listen. You would normally listen for 1 full minute. You would listen to your heart in 5 different spots, listening for any murmurs, any clicks, any type of abnormal heartbeats. You want to make sure the patient has S1 and S2, and you would know if you heard S3 or S4. 5 different cardiac sites. You would listen to the apical pulse for 1 full minute. Next, you would listen to the patient's lungs. You would listen on both sides, in the front and the back. I already listened to the back. The lungs were clear. No rhonchi, no wheezes, no crackles. Do you have asthma or COPD? Do you smoke? Any complications breathing? Any history of inhaler use or anything? No? Alrighty. Next, I'm going to listen to the patient's abdomen in all 4 quadrants. I can just listen to your belly. Alright. Bowel sounds are active. If they were hypoactive, we would have to listen to for 5 full minutes to hear that we didn't hear any bowel sounds at all. They would be absent. She has bowel sounds in all 4 quadrants. We would then palpate her abdomen. We could do a light palpation to feel around, but a deep palpation is generally for the doctors to do since the liver is so far up under the rib cage. We would continue by listening to the pulses in the femoral, behind the back of the knee, the popliteal, on the back of the side of the foot, the dorsalis pedis, and then the top of the foot. We would work our way down, and everything we did on one side we would do on the other to make sure that everything is symmetrical on both sides. Next, I would explain, since this patient